Hi everyone, I'm Dr. Jennifer Jackson. I'm a registered nurse and in the Faculty of Nursing at the University of Calgary. And this video is the third in the series on ethical research. And in this video, we're talking about how do we actually do research ethically. So we've looked at what ethics is and what some of the key concepts with ethics are. We've talked about a legacy of bad research, and now we're going to focus on how do we do good research? How do we make sure our research is ethical and that we are supporting the people who are participating in our research? And how do we set it up so that we have good outcomes and usable information? So it's important to remember that the person who's responsible for ethical practice is the researcher, not the participant. So at all times, a researcher is responsible for their own study and their own practice. And that can mean that you're responsible for everybody who's working on the project. It can also mean you're responsible for a kind of small corner of maybe a large study. But it is always your responsibility to advocate for ethics. So even if you are in quite a junior role, if you are worried that, say, some researchers are making up data to make the numbers look more the way you want them to, it is your responsibility to be a whistleblower in that situation, which can be really difficult. You know, if this is multinational, multi-million-dollar study and you are a lone RA, research assistant who's worried about, the consequences of things, you still have a responsibility to whistleblow and to advocate, because the responsibility is always with the researcher, and each individual researcher must be responsible for their work and the ethical quality of their work. So it's important to recognize that the duties that you have towards research participants are as strict, if not more strict, than those you have towards patients. So confidentiality is extremely important, and you have to safeguard everything that pertains to those patients. Also, for most researchers, there's no medical records department or HR department. You are that. So, for example, I have to keep records of all my participants. I have to keep them secret and protected, but I must keep them for up to 7 years. So if there was ever something that happened that I needed to go back to those participants and maybe warn them about something or try and make sure they weren't harmed in some way, that I have their information and I can do that. It's also important to remember that research relationships are not therapeutic relationships. So you may have somebody say to you, I found it really difficult because I didn't have enough food to eat, and so that made me really stressed out while I was experiencing this life event. So I think your instinct is always to say, like, oh, well, do you have enough food now? Like, I can go to the grocery store and I can get some for you, or I can, help you find the food bank. Do you have resources? Do you have supports? That's not the role of a researcher. That's maybe the role of a nurse, but it's not the role of a researcher. So researcher, you are there to work with the participant and collect data. So that doesn't mean that you just leave somebody hungry. It means that you say, okay, well, I'm going to contact somebody who can support you with this, but it's not you that does it. You are not there to problem solve issues with the participants. And that can be hard if they say, like, well, I was supposed to have a referral and nobody ever called me back. You might want to jump right in and say, well, did you call patient services? Did you call the switchboard? Did you do this? Did you do this? You have to restrain that and focus on what is the research question, what is the research purpose, and how are you working with this participant? It's fine to direct people to other services, and it's part of your responsibility as a healthcare professional to make sure that people get the care they need, but you are not the one providing a therapeutic intervention. You refer them to someone else to do that. And this gets difficult. It's not always really clear cut. And, I've done research interviews with people I know socially, and it's hard to know, like, where are the lines in that situation? And what if they say something that's really alarming and you feel like you need to report that to someone? These are things you need to think about because you could be in these situations. So I was doing research with a vulnerable population and a service that they use. And in the interviews, one of the participants said something about how a person was denied care. And from the way it was stated, it ran the risk of sounding like abandonment, which violates our nursing code of ethics. So, I wasn't there. This was like a year after the fact, but I was going through this transcript and found this information. So, I have a duty there, even though I didn't provide care to this person, I have to make sure they're okay. So I contacted the manager and I said, I just wanted to let you know, I read about an incident in this transcript. Are you aware of this? And could you follow up with me? It turns out the manager was aware, it had been addressed, they had put new policies into place and dealt with the individuals involved at a local level. And that was all that needed to happen. But it was up to me to make sure that that conversation had taken place because it was my duty to protect the participants. So when we're thinking about ethical research, there are some things you have to have in place for the study to be ethical. So the research must be necessary and contribute to further knowledge. All research creates burden. It costs money, it takes time, and having someone participate in it, they are experiencing vulnerability to contribute to knowledge. So if that's going to happen, you need to have a purpose. Increasingly, there's a focus on patient-centered research or issues that patients care about so that we know that we're not just iterating on kind of biological issues. We're actually focusing where patients are concerned as well, or where patient experience could be improved. So that doesn't apply to everything, but increasingly you're seeing patient and public involvement in research to make sure you're asking questions that are really important to the people who are affected by services. So participants must have a full explanation of what the study is, why you are doing it, and they have to provide consent. They have to provide consent before they be involved, and in some cases, they may need to provide consent again as you go through the research process. So if you've ever completed a research survey online, there's probably a page that explains, how your data is used, what the purpose of the study is, and then at the bottom you have to click I consent or I agree before you can start the survey. So that's an example of you providing consent to participate in the research. And the clarity of the consent kind of reflects the risk of the research. So for a survey, maybe asking you about your experiences during COVID, having that blurb at the beginning and then you click I agree and then you answer the questions, that's completely acceptable. If you are asking people about something that's really vulnerable, you might have them read that, click I agree, give their email address, you email them and set up a time where you can have a Zoom call to talk about the study in a little bit more detail. So you're really clear that person knows what they're getting into before they start. So there are some exceptions. For example, if you are studying crowd behavior during a festival, it would be impossible to consent every person who's involved. And if you walk out with a megaphone and say, I am observing everyone in the festival, act normal, like A, half the people aren't going to hear you. B, everybody who does hear you is going to like, what does normal mean? How do I act normal? Or like, why the heck are you doing this? And you're not then observing regular conditions. Everything gets warped in what you're doing. So if you're observing, say, crowd behavior, it may be that you don't have to have participant consent. That can only occur if you are not changing anything in the environment. So if you are just letting things happen as they normally would, then there are exceptions where you can proceed with research without consent. However, if you are maybe introducing new bike lanes or new structures into a space and you're trying to see how people are using it, then it becomes more of a gray area. So if you are interfering at all or attempting to influence the behavior in that environment, then you have to have consent. Sometimes if you're doing observational research, looking at crowd behavior, you might put up some signs around to say a researcher is looking at crowd behavior in this space. Just be aware. If you don't want to be involved, please call this number, and something like that. Even if you're doing that research, you would still need to have permissions from the festival or from the city or from whoever is kind of managing that space. So even if you don't have to have informed consent from every single participant, you still need to have approvals that you can go ahead and do this. So it's very important that no one ever goes and collects data. If someone just goes out and does it, if someone tells you to do that, you need to say no and ask questions. Like, you need to see an ethical approval. You might need to see site approvals. You've got to make sure it's all in place before the data collection can happen. Participants must understand that they have a right to refuse, and that maybe they talk to you during an interview, but after the fact, they feel really vulnerable and say, you know what, I don't want that to be used. Then you can pull their information out of the study and it is excluded. So people have to know that they have the right to stop participating at any point during data collection, and usually up to a certain point after. It's also important to recognize that you don't want to give people things that would violate their consent, or override their consent. So if you were saying, there are studies where they say, you can come, we're going to infect you with the flu virus, you stay in this space for 10 days, we will give you $2,000, and then we're going to see how your symptoms go and see if this medication works to help treat your symptoms. So there are studies like that occur where people, might take a week off of work to go be infected with something and receive an amount of money for that. So for something like that, like $2,000 is not unreasonable. However, if you have somebody say, I will buy you a house and give you $1 million for you to be infected with COVID for 2 weeks at our facility. So I'm exaggerating a bit to make a point here, but if someone is offering something disproportionate, like if you're going to give somebody more than their annual salary, you're not creating conditions where they can consent. You're creating such a strong incentive that they can no longer ethically provide consent in those situations. So, I think instances with that are rare for the most part because they're not funded at that level, but you just have to be aware that you're not coercing anyone or offering them something that is so disproportionate to the research that it would make them participate even when it's not in their best interest. You also have to maintain confidentiality. This can get tricky depending on the type of research. I know there's been studies where the researchers have worked with people who have done illegal activity. I've done research with people who've used drugs, or you might have research with people who sell drugs or engage in illicit sexual behavior that may not be something that's acceptable in the mainstream. So you have to protect those people's identities, and it becomes an issue. Maybe the police, there's historic examples of where the police wanted to arrest people that were involved in the study, but the researcher would not give the names because they said, no, I have an ethical responsibility to protect these people. So there are limitations. So just like confidentiality, if there's a risk of harm to self, risk of harm to others, or suspected abuse of children, you must report. Those are limits of confidentiality. But if somebody says to you, you know, I stole some stuff and then that helped me get money to buy drugs, yes, you could report that as a crime and potentially that person is arrested. But usually with a research perspective, you'll say, actually, can you tell me more about why you did that? And what was that experience like? And what was motivating you? And that information is actually a lot more helpful for our societal response than it is to just say, oh, you're a bad person and call the police. So this is murky and there's different limitations, but you need to be aware of consequences for your participants, no matter what research is happening in that space. Okay, other ingredients. The researcher has to know what they're doing. You cannot have somebody, especially working with vulnerable people, who's just going to go try and have some fun and see how this goes and maybe try and get something together for their master's. So by all means, you can have people who are students who are learning, but they need to be working with supervisors. This falls under the idea of like all research creates burden. And so if a person doesn't have the appropriate support, they're creating undue burden and potentially harm for participants. And you have to protect people from harm. So you have to make sure that, you know, your questions are not, if you're interviewing someone, your questions are not unnecessarily invasive, or, you know, you're not asking people to do something where they could possibly be injured, or any number of things. There are times where, you know, maybe you want to take some blood from someone. That may cause a small amount of pain and have a risk of harm, but that has to be considered in the context of like that risk benefit type of equation, is saying, are we protecting participants from undue suffering in this situation? You must make it clear the relationship between who is giving you the money for research and the researcher. It still shocks me that sometimes people really screw this up. So like, for example, you'll see research that's funded by the tobacco industry or the alcohol industry. And usually the results of that are, you know, tobacco or alcohol are maybe not as harmful as we thought they were. And that is really problematic in my mind. There's also some, like, for example, there was a like plasma expander called Voluven, and you know, was being used post-surgically to increase people's circulating volume, get their blood pressure back up. Well, it turns out that the person who had done the vast majority of research on Voluven was being paid by the Voluven company. So now, to my understanding, that product's not really being used anymore because there was no evidence that was independent. This conflict of interest had made it impossible to say whether or not this product actually worked and was safe. So, I mean, how many people got administrations of that by IV? It could potentially be very harmful, but you know, this person had a pretty good racket where they got paid to promote this product by saying it worked really well, and it was wildly unethical to do so. Also, ethical issues are something you don't just do at the beginning. It's an ongoing process you have to always consider. Things can come up, you know, with COVID, it might not have been ethical to have people in a room to do a focus group anymore. So then you have to change your approach to the research. But if you're making those changes, then you have to have approval to do things differently. And it's something that has to be revisited the whole way through. So when we're talking about the whole research process, when we think about planning, you want to think, what ethical issues do you anticipate? How can you manage these? For example, if you are working with a population who is new to Canada, you might need to have information sheets in more than one language. If you're thinking about the approvals and funding you need to have in place, you need to make sure that all the approvals are obtained and that you are telling people who is giving you money. So for the most part, most research councils, no problem. But Again, if you're thinking about like the alcohol industry wants to give you some money, and you're looking at research on alcohol consumption, you want to run in the other direction. When you're recruiting participants, you can't persuade people to participate. You can ask about their reasons to decline and make sure that there's no misunderstanding, but you have to respect their autonomy. And so you can't coax somebody into do it. If they say no, that's the end of the conversation. You also have to make sure vulnerable participants receive extra protections and that you're very mindful of consent the whole way through the process. When you're collecting data, you need to be sure to keep all of your records meticulous. Even if you are, a student who's doing a small piece of a study during the summer, you are the records department. So you have to keep track of like exactly which participants' work you're working on, what you did on what day. You have to be very, very detailed because, if you're working on data entry around chemotherapy outcomes, like that could make the difference whether a new drug goes to market or not. So you have to have a very high degree of precision in your work. You can't, when it comes to analysis, you can't favor findings. You have to represent things accurately. And this can be really hard when, like for my master's, one of my supervisors focused all her research on the importance of the family in the intensive care unit. And in my study, I found that the family actually creates conflict sometimes in the intensive care unit. And that created conflict in our research team because my findings were contrary to what this professor held as being true. But I had asked my participants and that's what they told me. So I couldn't change what I found just to make it like a nicer message. I had to tell the truth as I saw it. You also you have to be careful like what you emphasize or what you can't fish for results. So you might have like one really interesting thing that's, you get a quote that's really sexy or really provocative. But if that's not the main point of the study and that's not a central idea, you have to make sure that you're representing what people say fairly. And that's difficult to do for sure. You also need to make sure you are sharing your findings, and like people have trusted you with, some of their time to fill out a survey or with some of their reflections during an interview or whatever the case may be. So you have the responsibility to share that information with the wider world. You have to transcend what might be socially acceptable or professionally strategic because you owe it to people to share the knowledge you've created. And an example of this is that one time I found that there was a clause in a union contract that was harmful to nurses. And at that point in time, the union was negotiating with the hospital association to renew the contract. And I had found evidence that there was a piece of the contract that was harmful for nurses. And so like they're in the middle of provincially going to binding arbitration. And I kind of got out easy of that situation because I sent it to the union and then I left the country. But, things like that, it was like, I have a very important piece of info based on my research and it has huge political ramifications. A lot of the things I'm doing now, like looking at harm reduction, safe injection sites, supervised drug consumption, is very politically fraught. But I have a responsibility to tell the story as it is. And that may include things that aren't positive about those services, even though I very much believe in the aims and objectives of those services. But it's my responsibility to tell, the truth, the whole truth, and nothing but the truth. Like, this is my role. So it's a very difficult thing to navigate, and it's not something you take for granted. Also, equity is central to research, and it's something we always need to be mindful of, particularly with the legacy of awful research that has happened in the past. So when you are thinking about your studies, you need to think about who's included and who's left out. Now, some of the studies I have done have been majority white women or all white women, and you know what? Sometimes that was the only people I could get them to talk to me, and I had 1 year to get something done, and that was it. So I've recognized that sometimes this is challenging, and I wish I had done those studies differently and that they had included more diverse people. But that was not what I had. Like, my money was running out. I had to get the degree done. That was all I could do. So what I wrote was, these results exclude a lot of other groups, and I cannot say that this is the experience of everyone. It's an experience of these participants, and we need to do more research to understand the whole story. For example, on D2L, I put at one point, the ECG was created through scientific procedure. Was there anyone with breasts in the room that day when they were creating the ECG? I am sure not, because they created something that really works well on men, but for someone with breasts, it is not an easy procedure to do. Same here for pulse oximetry. So what we're seeing in this graph is that the pulse oximetry measures saturation more accurately than in white patients than Black patients. So when you have that on your finger and there's the infrared light is there and it's scanning your pulse oximetry, it underestimates the oxygen level of Black patients. Or sorry, it measures at lower rates. So that goes to show that, like, when we're creating something like a pulse oximeter, it has to be tested on lots of different people, and we have to make sure that we're getting safe results for everybody. So that when we see we have an oxygen saturation of 95%, we know that that's what's actually happening. And this is the kind of thing that we need to be aware of as clinicians, even if we don't work in the research field, so that, maybe you have a patient who is Black who has an oxygen saturation of 90, and you say, okay, well, 90 is fine. But if they're short of breath, you might stop for a second and say, you know what, it's really important that we focus on the patient symptomology here, because we know this technology can be flawed. So how can we make sure we manage your breathlessness rather than just making the number on the screen look nice? So we need to make sure that we have research that includes everyone, not necessarily in a single study, because that can be hard to achieve, particularly at a student level. But we need to have a broad scope of research where everybody has an opportunity to share their experiences. This was one of the key points with COVID-19 when they talked about, did they have African Americans in the drug trials in the US? It was really nice to hear those conversations in mainstream media, because it means that awareness of the importance of equity is starting to grow, which is a great thing. So when we're thinking about sensitive issues in research, there's a lot of people, as you see listed here, that you need to have a high degree of sensitivity. However, that doesn't mean we don't do research in those areas. So we need to do research with people with terminal illness. We need to understand their experiences and how we can make their experience of receiving healthcare as high quality as possible. But we may need to take extra things into account and be more careful to make sure that we are protecting those participants. This can apply also when we're looking at sensitive topics, maybe say experiences of sexual assault. That is a case where that's a really hard thing, but it doesn't mean we never do research in that space. It means that we do research with heightened caution and extra protection for participants. So it might be something where we offer free counseling for participants in addition to their participation. Or, maybe I've done where at the end of the study, I give people a magnet that has the employee assistance number on it, so that if, talking to me has churned up some negative feelings, they can call that number and it's a prompt for them to say, you know what, you have free support available to you. Feel free to use it if that's helpful. So you have to do more work the more vulnerable the population is. And so whenever you are part of research, you'll probably see some provisions built in to make sure that if you're working with people who are experiencing vulnerability, you're providing a lot of support and very, very careful about consent. Finally, I want to make a note that you also need to be careful for yourself. So research doesn't happen in a vacuum. It's related to our experiences. It's related to all kinds of things that are happening. It happens in context. And there's a growing understanding that research is actually really hard on the person doing it sometimes. And in order for a study to be ethical, it has to take care of you too. So the primary important part is protecting the participants, but your well-being also matters. So, for example, I had an interview with a participant one time, and we were talking about things that were difficult in their workday. Part of that interview included quite a graphic story of a person who committed suicide, and the nurse had observed this happening. And so that was a really important moment in that interview to talk about that experience. And then at the end of the interview, I made sure, that participant had support and, they had somebody else to talk to if they wanted to. But then I went out and I walked around the block for 20 minutes before I could kind of even get on the bus to go home afterwards. And I realized that I needed somebody to talk to as well, because I had just heard this really graphic story. And, I'm an empathetic person. It really affected me. And I felt horrible for all the people who were involved. So there's times when it can be really hard, particularly for people who, study injustice in any form. There's talk that it can be really powerless. I know for some people who are climate change researchers, it's like a known thing that sometimes at climate change conferences, people will be in the middle of a presentation and they're talking about how horrible things are and how bad the emissions are. And they'll just have a breakdown and they won't even be able to finish their presentations. And people will just start weeping because the news is quite dire. And so we have to take care of ourselves too. And this is something that is essential for every nurse, no matter where you work. But I think it's important to think about that in research as well, because I think, people understand if an ICU nurse is burnt out. They wouldn't necessarily understand if a research nurse is burnt out. But, you engage with the secret lives of folks, and sometimes you have people tell you things that they've never said out loud before. And that is a huge responsibility, but you have to make sure that you're taking care of yourself so that you can do that work well. So in conclusion, research is essential to create a profession, and it's also a way of changing the world and making nursing better and advocating for people that we serve. We just have to make sure that it's ethical. Above anything else, it must be ethical, because that is our professional responsibility, and that's what we owe to ourselves and everyone we work with. So that brings our discussion of ethics to a close. Thank you very much.